So let's talk about VBAC. VBAC stands for vaginal birth after C-section. And that is, after you've had a C-section and you get pregnant again, can you deliver vaginally or do you have to have another C-section? Now it's kind of interesting how history works, because when we first started doing C-sections, there was this mantra, once a C-section, always a C-section. People started then experimenting, is it safe to deliver vaginally after a C-section? We found out that it actually was, and for a while we were pretty much insisting that people at least attempt to deliver vaginal after a C-section. Well, the pendulum has swung again, and unfortunately, in my opinion, has swung too far, so that now in most communities, for instance the one that I live in, that you cannot have a vaginal birth after a C-section. And the reason is fairly complicated in some ways, but in reality it basically boils down to malpractice concerns and malpractice insurance. What happened was American College of Obstetrics and Gynecology, which is sort of our governing board, came out with a statement saying that in order for a hospital to offer VBAC, they had to have an OR team, an anesthesiologist, and an obstetrician immediately available. And it was that word immediately that became controversial, and that exactly how is that defined and what type of service needs to be provided to keep the hospital, the doctor, and the nurses on reasonable legal footing to be providing VBAC safely. And what that basically has come down to is people believe that you need to have all those people in the hospital at all times if you're going to be performing VBACs, and that's sort of been the rub. And so what's happened is that in most non-teaching hospitals, and even in some teaching hospitals, they don't feel that they can provide that level of service, and they're not willing to take the malpractice liability risk, and so they stopped delivering by VBAC. Hospitals won't offer VBACs anymore. So for example, at our hospital, if you wanted to deliver vaginally after having a C-section, you can't do it at our hospital, which means I can't have you as a patient. And ultimately, you'd have to transfer to another city outside of our county even that provides that service. In my opinion, that's very unfortunate, but it's the reality. And people will say, well, I want to have a VBAC and I want to deliver at that hospital, why can't I? My explanation is, well, that's sort of like going to McDonald's and insisting that you get pizza. You know what? You're not going to get pizza at McDonald's because they don't serve it. And so at our hospital, for example, we don't offer VBAC, so that's not something that you can have. I'm hoping in the future that that's going to change. It's going to probably take liability reform to do that, but unfortunately that's the reality that we live in. And the bottom line is the hospital's insurance will not cover them if they deliver patients vaginally after C-section, and therefore the hospital's not willing to take that risk. And so that's where we are right now with C-sections, so that once you have a C-section in most communities, you're going to have a C-section from then on.
Medtwice.com